Hello and a warm welcome to Smell-Bell-Verbal Cephalo cervical surgical anatomy songs of the head and neck. Today we are going to deal about the anatomy of the nasal bones. Anatomy of the nasal bones. Nasal bones lie in this particular part where my spectacle is resting. Nasal bones are present at this particular part where my center of the spectacle is resting. There are two nasal bones. Nasal bones, nasal bones, nasal bones are two in number. Like a book place like this, like a book place like this. This is the left, this is the right, both opposed together on either side. There is a frontal process of maxilla on either side. There is a frontal process of maxilla. It has two surfaces, lateral one, medial surface. Both are opposed like this. It has got four borders, superior, inferior, medial one and lateral, medial and lateral one. At last they form a configuration like a book and present over here, over here, over here. In the center there is a foramen for the sake of the vein that comes out of the nasal bones, and it is there just like this. Superiorly is the frontal bone, superiorly is the frontal bone lying like this. Laterally is the frontal process of a maxillary bone. Medially is the joint between these two nasal bones. If you turn them back, they are just like this. Superiorly is the nasal spine of frontal bone. In between is the position of this particular perpendicular plate of ethmoid. Inferior is the septal cartilage. Opposed together and they form this particular joint. Posteriorly there is the groove for anterior ethmoid nerve. Thus the nasal bones articulate in between these two, in between two nasal bones there is the articulation like this. If you turn posteriorly you can see the anterior ethmoidal nerve, and in between there will be the perpendicular plate of ethmoid and inferior septal cartilage. Superiorly is the nasal spine of frontal bone, as you are able to see. And then once again laterally is your frontal process of maxilla on this side and frontal process of maxilla on this side. Superiorly is the frontal bone and anteriorly is the foramen for the venous plexus that comes out from that. So this particularly forms the nasal bone anatomy which are present over here and here. So this is the fractures of the nasal bone occur, may be compressed like this or can be open like this, open book or closed book. So they have to be treated within first 1 week. So first 3 days we have to give, if there is an edema we have to give rest and then give any painkillers, and later on afterwards when there is edema subsides you can just correct them with Walsham's forceps which corrects the nasal bones and Ash's forceps which corrects the nasal septum like this. So as it is, and place a plaster of Paris cast or a splint on the nose which corrects the nasal bones. This is an important feature of the fracture of the nasal bones in ENT. So this is the maxilla and this is the frontal process of maxilla attached to this particular nasal bone. So this is how you understand the anatomy of the nasal bones as simplified as a song, as you can see. Anatomy of nasal bones is just complete. So like the videos, kindly share and subscribe. Smell-Bell-Verbal anatomy song videos. Dr.Smell-Bell-Verbal India.